Psychosocial aspects of rehabilitation. Rehabilitation adherence and compliance are two words that are often used interchangeably. However, the meaning of these two words do differ slightly. The term adherence refers to a description of behaviors that are aimed at a particular outcome, whereas compliance can be defined as an individual completing a required behavior. If we think of this practically, adherence is a range of behaviors, while compliance is a specific behavior, either being completed or not completed. For example, an athlete may be compliant with wearing a prescribed brace, but may not be adherent with the overall rehabilitation plan. Rehabilitation non-adherence can decrease overall rehabilitation outcomes and may increase the chance of re-injury. There are two primary ways in which an athlete can be non-adherent to a plan. Rehabilitation over-adherence is the athlete doing more than the rehabilitation program calls for, whereas under-adherence is the athlete doing less than the rehabilitation program is calling for. Rehabilitation programs will only be successful to the degree that the athlete completes or adheres to it. There are a variety of factors that can influence adherence to the rehabilitation program. Some of these factors include the characteristics of the injury, socio-demographic factors, social and contextual factors, and psychological factors. When we think about injury characteristics, one of the things that has been identified is the athletes who have more severe injuries are generally more adherent to their rehabilitation program compared to those with less severe injuries. The only socio-demographic factor that has been linked to adherence is age. And with that, younger athletes usually display better adherence to their rehabilitation programs than do older athletes. There are several social and contextual factors that have been found to be predictive of injury rehabilitation adherence. For example, athletes tend to adhere better to their injury rehabilitation program when they perceive their clinical environment as comfortable, or when the scheduling of the appointment is convenient, and when others around them are supportive of their rehabilitation activities. The psychological factors. When it comes to psychological factors, there are several that have been identified as potential contributors to sport injury rehabilitation adherence. Some of those psychological factors include personal, cognitive, and emotional and behavioral factors. Personal factors include things such as pain tolerance and self-motivation. And in here, athletes tend to believe that their behavior can affect their health status. In terms of cognitive factors, athletes tend to be more likely to adhere to rehabilitation when they believe their treatment is effective. It is common for athletes to value their rehabilitation highly when they perceive their level of exertion is high, and during times of rehabilitation activities when they can identify stable and personally controllable factors as responsible for their recovery, and also when they have confidence in their ability to cope with their injury. Emotional and behavioral factors that influence the rehabilitation process include the presence of mood disturbances, as individuals with mood disturbances are generally less adherent to their program. Athletes who adhere well to their rehabilitation program tend to report seeking information about their injuries and engaging in other similar coping behaviors at a greater extent than less adherent athletes. Measures of adherence need to take into account the variety of context in which sport injury rehabilitation occurs, which primarily includes clinics such as the Athletic Training Center, as well as the home. When it comes to assisting home-based rehabilitation activity, it is a little more challenging because we cannot directly observe these activities. Most commonly, the best option for assessing adherence to home-based activity is simply to ask the athlete or the patient about the extent to which they're adhering to their home program. One of the issues with this is that they are completely based on self-reported data, which is going to be subjected to inaccuracies for a variety of reasons. Whether it is just that the athlete is forgetting, or that they are responding in the way that they think that you want them to respond, or giving you the answer that you just want to hear, there may be inaccuracies. There are several options for assessing clinical based rehabilitation outcomes and activities. The first one that we're going to discuss is called the Sports Medicine Observation Code, or the SMC. This was developed to facilitate the direct systematic observation of athletes during rehabilitation sessions. In this measure, the observer is going to record the duration and the frequency of 13 different behaviors occurring at selected points in time over the course of a rehabilitation session. The SMC yields a detailed account of how athletes spend their time during the rehabilitation session, but it only provides information about adherence to the extent that the observed frequency and duration of on and off task behaviors is compared with those specified in the rehabilitation protocol. The SMC is also time consuming and labor intensive, and as a result, it is not practical in many clinical settings. A more feasible option for many athletic trainers is for them to document their perceptions of athletes' adherence to their rehabilitation protocol during their clinical appointments. This can be done informally. However, informal observations can be difficult to compare over time or even quantify. This is one of the benefits of using a standardized instrument. Another instrument can be used that was tailored specifically for assessing adherence to rehabilitation in the athletic training environment is the Rehabilitation Adherence Measure for Athletic Training, or RADMAT. The RADMAT is a 16-item questionnaire where athletic trainers rate the behavior of athletes or patients with respect to their communication, attitude, and effort and attendance and participation in rehabilitation sessions. The RADMAT has been shown to discriminate among high, moderate, and low levels of adherence and can be useful for identifying athletes who fail to participate adequately in rehabilitation activities and who do not communicate effectively with their athletic trainer, or those who just go through the motions of their rehabilitation plan. Similar to the RADMAT, the Sports Injury Rehabilitation Adherence Scale can discriminate among high, moderate, and low levels of adherence. However, with only 3 items, the Sports Injury Rehabilitation Adherence Scale is more brief and much less comprehensive than the RADMAT. As a result, the RADMAT would be the instrument of choice if the purpose is to identify areas of clinical-based rehabilitation adherence that are in need of enhancement or addressing, whereas the Sport Injury Rehabilitation Adherence Scale may be the more suitable instrument for repeated administrations over the course of a rehabilitation plan. There are a variety of factors that can impact rehabilitation adherence. Athletes are most likely to adhere when they have a personal characteristic that enables adherence to rehabilitation programs that may be challenging. They're also more likely to be adherent to the rehabilitation program when they recognize that their injury warrants care and that they're part of the rehabilitation environment that is conducive to adherence. It is also important that the athlete is not overwhelmed by pain or emotions. Additionally, athletes or patients are generally more adherent when they attribute their recovery to behaviors that are within their control and that they have trust in the value of their rehabilitation program. It is also important that the athlete is confident in their ability to successfully complete their rehabilitation program. Enhancing rehabilitation adherence and outcomes. To achieve optimal outcomes following sport injury rehabilitation, athletic trainers and healthcare professionals need to identify and address multiple biological, psychological, and social factors that influence rehabilitation adherence. There are 4 main steps to enhancing rehabilitation adherence and outcomes. First, you need to obtain the athlete's background based on a biopsychosocial perspective. The next step is to identify potential biopsychosocial barriers. Then, to identify strategies to avoid or reduce those barriers. And then, the final step is going to be to implement strategies to avoid or reduce those barriers. As we just discussed, the first thing is to obtain the athlete's background based on a biopsychosocial perspective. The first step in this process is a modification of a routine history at the beginning of a rehabilitation process. In this process, the athletic trainer or healthcare professional should address factors beyond the biological components of the injury. This history should include the characteristics of the injury, socio-demographic factors, biological factors, psychological factors, and social and contextual factors. In this figure on this slide, you can see an example of some of these factors that may contribute to this injury. Each of these various categories may influence the rehabilitation plan. The next step is to identify potential biopsychosocial barriers. Once a potential barrier is identified, strategies for avoiding or reducing the barriers need to be made. As you can see on the table on this slide, potential barriers should be identified for all areas of the biopsychosocial perspective, including the injury characteristics, biological factors, socio-demographic factors, social context, contextual factors, and the psychological factors. Once we have identified strategies to reduce the barriers in each of these areas, we will need to implement some strategies to avoid or reduce the barriers. Many strategies can be seamlessly integrated into a rehabilitation programming to help with this process. When implementing strategies, it can be helpful to create what is called a next step checklist that helps remind the athlete when and how these strategies will be incorporated into a rehabilitation plan and into the ultimate return to play progression. Psychosocial strategies should be implemented throughout the rehabilitation program. Some of the key strategies that need to be addressed include education, motivational strategies, and relaxation and stress management techniques. Educating the athlete is one of the most important things that we can do in the rehabilitation process, particularly at the beginning of the rehabilitation process. Education increases the patient or athlete's understanding and knowledge of their injuries and the rehabilitation process that will follow. This also plays a role in many aspects of the adherence, including prevention of overadherence. Increasing the athlete's or patient's understanding and knowledge of their injury and the rehab process influences their cognitive appraisal of the situation, which in turn influences their emotional and behavioral responses, hopefully in a positive manner. When it comes to motivational strategies, goal setting and positive self-talk are two strategies that are effective at enhancing rehabilitation adherence. The athletic trainer or healthcare professional should guide the athlete through effective and appropriate goal setting through each phase of the rehabilitation process to ensure that the goals are specific, measurable, and realistic to help with the athlete motivation. Positive self-talk might be helpful in increasing the athlete's self-efficacy and rehabilitation, which may enhance their performance in their rehabilitation. Stopping negative and unproductive thoughts and reframing them as positive, productive thoughts is a strategy that athletic trainers and other allied healthcare professionals can integrate into the rehabilitation process as well. Finally, relaxation and stress management are important as stress influences physical and psychological responses. As a result, stress might influence an athlete's motivation towards rehabilitation, and stress management techniques such as deep breathing and progressive muscle relaxation can be very helpful for decreasing that stress response.